new health threats like we saw last year with the H1N1 flu pandemic. So the major message that I'd like to leave with you today is that our department is eager to work on these issues. We're eager to work with all of you. Over the last 2 years, we've made a conscious effort to think about health more broadly and more inclusively, both inside and outside the doctor's office. And while we'll continue to make it a priority to collaborate more effectively across the federal government, we also know that the kind of change that all of you are seeking and that we join you in seeking is often best formulated at the community level. Often the best thing we can do is to support, invest in, and publicize these best practices to help them to spread. So I want to thank you for being here. Thank you for the work that you have been doing. Thank you for the work that you're about to do. And I know that these discussions will be productive. And I look forward to working with you to build a healthier, more prosperous country, one building, one block, one neighborhood at a time. Thanks very much.
Okay, where's Nancy's stool? It's a little high, but...
I think I'm here. Oh, well, I could be here. That would be good. Yep.
I'm not sure.
I'm moving down one.
We're moving down.
There you go.
So good afternoon, and thank you to Secretary Sebelius for her great remarks and for her recognition that environmental justice really does start in communities and that communities need to be at the heart and soul of any changes that we make to improve community health. My name is Diane Takbourian, and I'm the Executive Director of the Environmental Health Coalition in San Diego and Tijuana. We just celebrated our 30-year anniversary fighting for environmental justice in our region. Thanks. I also want to thank Nancy Sutley and Lisa Jackson, not for all of the things that we've all recognized here today, and not only for how they address environmental justice in CEQ and in EPA, but for their expansive view of how to make those changes. They're now expanding out all of our views of how to get those changes done and how to achieve environmental justice. I think that this audience does not need to be told that environmental justice starts where people are. It starts where people live, work, and play. And so we said this panel was one where we would talk about what the relevance of environmental justice and healthy communities is. And I would say, how is it not relevant? I don't think that this audience needs to be told what the critical intersections are of environmental justice and healthy communities. Why are place-based strategies important? Because that's where we are, and that's where all of us are working. We need to bring the force of the federal agencies together to create healthy communities in all of our regions, because environmental justice cannot be achieved in silos. None of us have one issue to deal with. And all of us who have achieved anything, one accomplishment, know that once you've achieved that and that you've learned the lexicon of EPA or DOD or whichever agency that you are dealing with and the sources of the pollution or the sources of the problem, you've exhausted yourself for a decade or more, and then you need to move on to the next one. We need a more comprehensive approach that requires that the federal government and all of those agencies come together to really build quality, healthy communities for all of us. We all know that in all of our communities we have excessive amounts of pollution. We all know that our health is at risk. If you start in a community where the kids in our communities live, we have dilapidated housing, and so we've got 3 times the rate of lead poisoning in our homes. And then we have 3 times the rate of asthma when they walk out the door because of the mobile and stationary source pollution. And those same homes are the ones that are the most energy inefficient. So we need help in that regard. Certainly at the local level with land use planning that is clearly discriminatory, we need the federal government's help, because someone said here that compliance is really not enough. It's not enough to have a compliant facility if it's located right next door to a home or a school. That doesn't make a difference, and it's discrimination of the worst kind. Elizabeth said, we recognize an environmental justice community when we see one, we got that. Well, some of us don't got that. We're getting some really good help, and I want to introduce this to you. All of the issues that we've talked about, from health to social determinants of health, are coming together in a really exciting new model called the Environmental Justice Screening Method. And Manuel Pastor, I think, is here, right here, and his team from Occidental, USC, and Berkeley are coming together to help this method be something that brings it together for all of us and for all of them who don't think that cumulative impacts really make a difference in all of our communities like we do. And so we're excited to use that method to identify environmental justice communities that really need the most help. And our California Environmental Justice Alliance, and many representatives are here today, have come up with something we're calling green zones, which means that those are the communities that need to be first in line for the force of the federal government and the collaboration of all of the agencies, and first in line for benefits, so that we can create truly quality, healthy communities across this nation. And we have come up with a concept paper that's in the back, and truly don't make me go home with a suitcase full of these, please. I'd appreciate it. So they are in the back, and we'd invite you to take a look at it and let us know how you feel this can impact your region. So we have a panel who I think is going to help us really take this conversation further about what the relationship is between place-based healthy communities and environmental justice, and it's my pleasure to introduce them all to you. We're going to use the same approach that the previous panel used and turn this right over to all of you for question and answers, and those will go straight to our panelists, who are Terry Adiram with HHS, Eddie Bautista, who is with the New York City Environmental Justice Alliance, and Rajiv Bhatia with the San Francisco Department of Public Health, Sharunda Buchanan at HHS also, John Jarvis with DOI, and Shelley Patricia. Is that right? Not
Great.
quite. Okay, with HUD. So this is a pretty stellar panel with lots of great expertise, and no one had to pronounce my last name, so I guess I got it. So thank you very much. Can't get too hung up on that. Had the worst done to me. So who has the first question? And I see that we have great folks with the microphones on all sides of the room. Dr. Bullard.
I had a question for the Fed's representatives. As I said before, we were here some while ago, a decade ago, and some of us, and there were environmental justice strategic plan strategies put together. I'd like to know if you've located them, dusted them off, trashed them, or whatever, where you are in the process of trying to make real, build on, extend, etc., improve on what was done, what was not done.
Which Fed goes first? Good afternoon. I'm Sharunda Buchanan. I work at the Centers for Disease Control and Prevention, and I represent not only CDC but also the Agency for Toxic Substances and Disease Registry today. And as has been said, that we were here a number of decades ago, and I actually want to applaud both Nancy and Lisa on bringing together the Interagency Work Group on Environmental Justice. I think that's been the impetus for various agencies, including CDC, ATSDR, to really look back and dust off the old plans, or, in other words, regenerate a new plan. And I, for one, I don't know if my director is out here, Dr. Chris Portier, who's the new NCH director at CDC, has said to me, Sharonda, I am committed to this. I am serious about this, and we do want to put together a plan that really advances environmental justice at the CDC and the Agency for Toxic Substances and Disease Registry. And he asked me just recently, would you join me in this effort? And I was honored to say, yes, I will. So we've already started to put the plans together, to look around to see what existed, because I think there's some good stuff in what has existed, and see how we can promote that and bring that into the 21st century. So we're committed, we're at it, we're on it.
I'll jump in here. I'm John Jarvis. I'm the director of the National Park Service and represent the Department of Interior. And I actually think we were probably not here 10 years ago. And I'm glad we're here this time, because you might be wondering why the National Park Service is at a meeting about environmental justice. And I think we have a big role in environmental justice. It's a clear recognition across this country, one, that parks, not just national parks, but that we have many urban national parks here in the city of Washington, in San Francisco, and in New York, play a critical role in public health. And the lack of parks is a contributor to the problems of environmental justice, that there is a lack of safe parks, there's a lack of parks in the neighborhoods, there's the lack of care for those parks, and there are park deserts. There are communities that just don't have parks, and that's an environmental justice issue. The National Park Service can play a significant role in improving parks and helping develop parks and creating parks through a variety of the programs that we administer. But we just haven't been part of the conversation, but we're here and we're committed to being part of it now.
Sure. Yeah, I'll take a shot at that. So I'm Shelley Potisha. I'm the director of a new office at HUD, the Office of Sustainable Housing and Communities. And we've been asked, or designated by Deputy Secretary Sims, who you'll see in the next panel, to be the liaison to this interagency working group on environmental justice. And I think it's, you might initially kind of think, why the Office of Sustainability being focused on environmental justice issues? And that's in part because Secretary Donovan has said that we need to move our approach and thinking about environmental justice into the 21st century. That we need to focus, yes, on the core aspects of exposure to lead and other kinds of building materials that create health problems, particularly asthma. We have a whole office that's focused around that, and they're getting continued and additional support from the Secretary. But there's also issues around exposure to risk of disaster. That's increasingly a big part of the role of HUD is helping folks prevent exposure to disaster, and there's a huge alignment of environmental justice communities that are in disaster-prone areas, and we need to get proactive about that. We also, though, need to look beyond this sort of small bore definition of HUD's role in environmental justice. We have taken a much more comprehensive view of community development to ensure that as we're investing in communities, we're creating opportunities for people to live active lives, have access to local health care options, that our formula funds are used correctly in order to achieve those goals more specifically. And at a broader level, the program that I direct has a new program that focuses on sustainable regional planning, which has an important role in ensuring that we don't continue to perpetuate the disparities in terms of access to job opportunities in a region, that we can ensure that as communities and regions grow, that folks of all races, incomes, and